I'm Benhood Bikdeli from the Cardiology Department at Columbia University Medical Center, New York Presbyterian Hospital. I also have academic affiliations with Yale School of Medicine and Center for Outcomes Research and Evaluation, as well as the Cardiovascular Research Foundation in New York. I'm a cardiology fellow currently at Columbia, but also have scholarly affiliations with the two other institutions that I mentioned. The topic of the talk that I gave was filtering the evidence with respect to inferior vena cava filters. My disclosures for the talk are, for a few of them, we received grant support from the National Institute of Health, and also I was an expert for a litigation with respect to a subtype of IVC filters. With that being said, the main focus of my talk in the meeting was with respect to evidence for efficacy of IVC filters as a class of device. It was based off a systematic review of the literature that we did a couple of years ago. In brief, we've seen that utilization of these devices has increased dramatically over the past 3 decades, and that in the face of the increased utilization, there hasn't really been much of evidence to prove the efficacy of these classes of devices. So we sought to determine the existing evidence for efficacy, compiling all the prospective controlled observational studies as well as randomized trials on the topic. And in summary, the results showed that as a class of device, use of IVC filters compared with control was associated with reduced risk of subsequent pulmonary embolism, but not a significantly different risk of pulmonary embolism-related mortality or all-cause mortality, and it was associated with increased risk of deep vein thrombosis. When we restricted our analyses specifically to retrievable IVC filters, what we noted was that there was no discernible difference either in the rate of subsequent PE or the mortality outcomes, with the largest caveat being that there were just so few studies with methodological limitations, but also a small number of patients being included. With respect to safety above and beyond deep vein thrombosis, I also touched upon a few systematic reviews that looked into other factors such as strut protrusions with IVC filters, as well as subsequent post-thrombotic syndrome, among others. So in totality, what we know is that evidence of efficacy and safety of these devices lags behind their utilization. So we need to do more and better studies to determine their safety as well as efficacy. And also we need to determine the healthcare costs and utilization rates across the different regions, including in the US and internationally. Thank you very much.